Welcome back to Active Chiropractic, guys, and today I'm going to show you the best way to ice yourself, especially if you have a strain, a sprain, or even bursitis. Now, bursitis is when a bursa, a sac of fluid, is inflamed and it swells up and causes a lot of pain. Now, these bursas are normally attached around the shoulder joint, the elbow joint, or the kneecap, or the Pes Anserine where the thigh muscles attach, and the Achilles tendon attach at the heel. Bursas are there as well. And of course, by icing these areas, it can help recovery and reduce the pain significantly. Alright, to start off, just fill up some polystyrene cups with any type of water, it doesn't really matter, and freeze them in the fridge for about a few hours. Once they are frozen, you are ready to peel off the bottom of the cups, and this will allow you to hold the ice without freezing your hands. Now, by doing this will give you greater precision than using small ice blocks or frozen peas. Now, to ice shoulder bursitis, usually caused by supraspinatus bursa, just try to find the bony part of your shoulder and just ice under it and around the area. In the early stages of shoulder bursitis, our main aim is to reduce pain and some swelling in the area. It's recommended to ice the area for about 20 to 30 minutes every 2 to 4 hours, according to physioworks.com. Now, it's important to know that inflammation is also needed to kickstart the healing process, so you don't want to eliminate inflammation totally. Now, in this condition, most importantly, don't sleep on your side of the area that's in pain, or even aggravate the shoulder in different type of movements, especially in this phase. Tennis elbow. Now, to ice the tennis elbow, find the tender ligaments on the outside of your elbow and then place the ice over it and slide it around that area approximately for about 10 minutes every 6 to 8 hours, according to physioroom.com. Like the other conditions, inflammation is very important in the first 48 to 72 hours, as this will help the healing stages. Keeping in mind, by placing the ice directly on the skin, it might be a bit too cold. Just stop if you need to, or modify the technique by putting something in between the ice and your skin. Icing the knee. The knee is a very common place to have injuries. Ice is mainly used in this area for bursitis and tendinitis of the patella tendon. To ice this area, it's just above the tibia, also known as the shin bone, below the kneecap. For bursitis, just ice it for about 20 to 30 minutes for every 2 to 3 hours. Now, for tendinitis, ice it for about 10 minutes every 6 to 8 hours, according to physioworks.com. Pes Anserine Bursitis. Another part that's commonly overlooked is the Pes Anserine. This is where a lot of problematic muscles attaches to the knee, such as the sartorius, which soccer players tend to injure, the gracilis, which is the inner thigh muscle, and the semitendinosus, which is part of the hamstrings. You can ice this area for about 20 minutes 3 to 4 times, according to orthoinfo.org. And of course, if it's too cold for your skin, just modify the technique by placing another towel or material between the ice and your skin. Achilles tendonitis is usually caused by a lot of running or exercises, and it's also caused by poor foot posture as well, for example dropping foot arch or flat feet. Now, the Achilles tendon comes from the calf muscle and attaches into heel bone. You can ice this area for about 10 to 20 minutes, 3 to 4 times a day. Ankle sprains. Now, all of us has gone through ankle sprains before, and it usually occurs on the outside of your ankle. Now, this is where small tears can happen in the ligaments of the ankle. These ligaments are found just under the bony prominence of your ankle. This place can swell up quite a lot, and it's probably best to compress the area and try to keep the swelling at a minimum, and even elevate the ankle up to reduce the swelling. You can ice this area for 20 to 30 minutes every 2 to 4 hours. The wrist is commonly injured in sports such as weightlifting, gymnastics, or falling over, and therefore you can sprain it quite easily. Once again, it's good to compress the area as this place can swell quite easily as well. Now, in the initial phase of the injury, you can ice the area for 20 to 30 minutes every 2 to 4 hours to reduce the pain and swelling in the area. Once again, guys, thanks for watching. Now, I want you guys to know that there's a condition called septic bursitis where it's caused by bacterial infection. So it's best to go see a professional and get checked out and get treated properly. Now, if you do have tendinitis in the Achilles tendon, check out my Achilles tendon video, or if you have hip issues, check out my hip videos as well. Remember to support my channel, hit subscribe, hit like, comment below if you have any questions, and I'll see you guys in the next one.